Hi everybody, this is Steve Valdez with Lonestar 24-hour emergency room, and I am here with the Dr. Bot, and he's such a great guy. And I'll tell you, if you get a chance to come on by, you'll see what I mean. But we're here to talk about Dr. Bot. It is hot outside, so tell people what they can do to cope with the heat.
Yeah, well, everything's bigger in Texas, including the temperatures. So it is definitely getting hot, and you got to be aware of overheating, obviously here in Texas. The most common symptoms you see with that is profuse sweating, feeling of exhaustion, sometimes getting nauseous. We describe that as overheating, a heat injury type of situation. So the important things you can do to kind of prevent that from getting worse. The first thing you want to do is get someone like that obviously out of the heat, get them into a shaded area or even preferably into AC. If you can, you want to remove as many clothes as possible. Leave the underwear on, nobody wants to see that. But other than that, you want to take all the clothes off that you can so they can help cool off as well. Some patients, their initial kind of presentation will be collapse from the heat, so they'll kind of pass out. So those are patients that you want to immediately kind of help to the ground, obviously move them in the shade, then have their legs up, say on a chair, until they recover. You don't want to stand them up too quickly. Give them a good 15-20 minutes to kind of feel completely back to normal. Otherwise, you stand them back up and they just pass out right again. After that, we move into kind of more serious situations, what we call heat exhaustion. That's a patient that usually presents with collapse. Sometimes they're a little bit confused, their heart rate is very fast, they just won't feel better. You're doing kind of all those things, but they're still staying nauseous. Those are patients that you want to kind of be more aggressive with in terms of cooling. If you can get them into like under cool water, even like submerge them, that's actually the best thing you can possibly do. But otherwise, yeah, other things you want to do is anything to get them cool and wet. So getting them into a cold shower, or even just if you're outside, just running a cold hose over them. If you're don't have that type of water available, you have ice packs, you can put ice on them, particularly in the armpits and the groins, because you have a lot more blood flow through those areas, so that cools the blood faster. But a patient that's having those symptoms, that's a patient that really needs to be brought to the hospital, to an emergency room where we can kind of have a more tailored response to the heat in their body. We have the ability to take care of that here. Things we would do is put an IV, give IV fluids, cooled, cold IV fluids, because that more rapidly brings the temperature down. We have the ability to kind of really monitor the internal temperature of the body to make sure we're having a goal that we're trying to hit. Check labs. Sometimes this type of heat exhaustion can actually cause damage to the organs, the kidneys and the muscles, so we want to check labs and make sure that's all being monitored and not sending the patient home until that has been corrected. So we have the ability to do that. Then you hear a lot of people say heat stroke. Heat stroke is actually pretty rare. It's extremely serious condition. It actually doesn't happen that often. It's a lot of times people say the word, but it doesn't happen. That's a patient that definitely needs to be rapidly transported, usually by ambulance, but to an ER where they need very kind of directed therapy to get them as cool as possible, as quickly as possible.
It's fantastic. I learned a lot just listening to you, and I always do when we talk. And so, ladies and gentlemen, don't forget, don't take it lightly. The heat can be very hard on body, and so take Dr. Bot's information, and don't forget that if you're in a situation where you're serious, we are like your best neighbor. Why? Because we are always here ready to help. And we thank you very much for your time, and then we're going to say goodbye.
Of course.
Bye.
Stay safe out there.